welcome to my channel. Today we're starting with something called axillary artery. 10 marks question on our most beautiful arteries, which actually starts off as the continuation of the subclavian artery. If you remember, the heart has three things, that is your subclavian artery, brachiocephalic artery and common carotid. So one of the most continuation branch seen in the axilla will be the axillary artery. This artery extends from the first rib, the outer border of the first rib in this particular region, to the lower border of teres major muscle. It's a very important artery. If you will remember, this subclavian artery begins like axillary artery, after some time ends off with brachial artery, which in turn divides in the cubital fossa into something called radial artery and ulnar artery. So this particular branch, axillary artery, has three parts. Very easy it is. The first part, second part and the third part, which actually is divided because of the pectoralis major, big muscle which is arising from the sternum going to the clavicular part and attached to that region. This particular muscle divides this artery into three parts. Superior part, which is proximal to the muscle, the posterior, which is deep to the muscle, and the inferior part, which is distal. The proximal to the muscle, the deep inside, the deep part as well as posterior it is, and this one, the inferior part, it is distal to the muscle. And so easy, the three parts have the following. First part has a single branch arising from that, second part has two branches arising from that, and the third part has got three branches arising from that. So this is the first introduction you need to write, the definition of the artery, its extent where it travels, and which muscle divides it into how many parts. Let us now go for the branches of this one. I have made a very simple and a very easy method for you. Just remember, any name, you can keep any S name. I have written here, Suman touches cool pad. Suman touches cool pad. I have a very favorite student of mine who does this work. Suman touches cool pad. So from Suman arises superior thoracic artery. Touches, from the T arises thoracoacromial artery. Cool arises clavicular artery. P, pectoral artery or branch. A for acromion and D for deltoid. Suman touches cool pad. When you are using mobile, obviously what is the next thing you have? You love snacks, right? So from L comes the lateral thoracic artery. From snacks comes your subscapular artery, which is further. What is snacks? Which is further divided into chips and T, right? Chips, we have circumflex humeral artery, which is the largest and the most important artery. And from T, we have an artery going towards the teres major muscle. And from the A we have the anterior circumflex humeral artery, and from the pastry we have something called posterior circumflex humeral artery. Easy method, just refer to any S name, you can write this person touches the cool pad and loves eating the snacks, which is chips and tea, as well as pastries, chips and teas, and this is the easy method for you to remember that. Now let's go for the little bit complicated part called as the relations. I have made a very easy method for you to remember the relations. Many videos will not give this. The relations of this particular, yes, we have to study. It's a 10 marks question. We need to know what is first part relations, second part, as well as third part. If you people clearly see here, the first part has anterior relations, posterior relations, medial as well as lateral relations. I have used each color for you to understand very easily. Anterior, we have very easy skin, superficial fascia, the deep fascia, we have the clavicopectoral fascia, the pectoralis major, we just studied the muscle now, and the communication loop between the lateral thoracic as well as the median thoracic nerve. So these are the relations in the anterior part. You need to just write this thing. Posteriorly, you have the first intercostal space, obviously the arteries in the back, so you come across the external intercostal muscle, one of the muscles of the respiration. Serratus anterior plus the serratus anterior nerve. Books will give you digitations, it's up to you. And the medial cord of the brachial plexus, it will meet us everywhere. Brachial plexus is because of the axillary artery, which divides it all the trunks, cords and stuff. Anterior relations, posterior. This is the only difficult part. Medially, it's just related to axillary vein. Copy this, it will meet us everywhere. The lateral relations is lateral as well as the posterior cord of brachial plexus. How you just have to remember. First to see this diagram, this particular notes now. Now I'm going to remove each one as I go now. Anterior relations, write everything. Skin, superficial fascia, deep fascia, and instead of the major, write the pectoralis minor muscle. That's it. No need to write the lateral the loop as well as the other any other thing here. Just the anterelations is everything. Skin, superficial fascia. In the second part we are talking now. Anterelations will be same thing. Skin, superficial fascia, deep fascia as well as pectoralis minor. Next. Posteriorly, everything is just now here we have the posterior. So posteriorly, this is the posterior cord of brachial plexus. Medially, medial cord of brachial plexus. Laterally, lateral cord of brachial plexus is almost the same. But posteriorly, we will meet coracobrachialis muscle, and medially, we will meet this particular branch here. That is medially the medial cord of brachial plexus and the medial pectoral nerve. Only 3 people have joining here: the coracobrachialis, the medial pectoral nerve, and this particular thing. Rest are all same. Third part relations are also very easy. Anteriorly, just write everything, just write extra additional thing will be the median nerve. Medially, what every time we have, that is the axillary vein as well as medial cutaneous nerve of the arm and forearm with ulnar nerve. This is all. The third part is only the nervous part, because we have the nerves related here. We have first the medial cutaneous nerve of arm, forearm, ulnar nerve. In the posterior, radial nerve, axillary nerve, subscapularis muscle, the tendons of the latissimus dorsi and teres major. And laterally, medial cutaneous nerve, median nerve, and coracobrachialis. This is all the nervous part here. Second part is very easy, and third part. Make simple and write like this. Next. We go to each muscle, very easy. Superior thoracic artery is a very small artery, absent in most of the dissections. Just it is the only branch of the first part, just supplies the 2 pectoral muscles, the pectoralis major and minor. The thoracoacromial, it just pierces the clavicopectoral fascia and then immediately divides into this cool pad thing. That is a clavicular branch supplying this sternoclavicular joint as well as the subclavius muscle below the clavicle. Pectoral supplies the breast as well as pectoralis major. Acromion just goes around the acromion. Deltoid will supply to the deltoid muscle. It's so easy, there's nothing much difficult here. From the L, lateral thoracic, it arises from the pectoralis minor, and then it's an artery for the female, supply the female breast as well as the pectoral regions in that side. And the most important for you will be subscapular artery. This is a very largest branch of the axillary artery. This subscapular artery, after passing from the subscapularis muscle, this goes down to the inferior angle of the scapula in this particular part. It just goes down to the inferior angle of the scapula, and then immediately it's related to the latissimus dorsi and the serratus anterior, to whom it supplies. Latissimus dorsi as well as serratus anterior. This muscle has 2 branches. That is number 1. The first branch is like after passing from this particular part, that is the first branch, that is the circumflex branch. This circumflex branch will give circumflex humeral artery, is a larger branch than this, passes through the triangular intermuscular space and then rounds in the around this of the scapula. It just rounds off the scapula, giving another branch called infraspinatus branch and infrascapular branch. So this circumflex humeral artery is a large branch giving 2 branches, infraspinatus and as well as the infrascapular. It just round around the scapula. It is just present around the scapula. This is the only difficult part. Next we have the anterior circumflex humeral artery. It's a very small branch. It's arising from the intermuscular sulcus in that region and just meets the posterior circumflex. It's the anterior, it's the posterior. Both of them form a surgical circle around the surgical neck of the humerus, and the anterior gives A above, P a little bit down. It gives an ascending branch supplying the head of the humerus and shoulder joint, and ascending branch, and a posterior circumflex humeral artery is a large branch from the quadrangular intermuscular space. It just supplies the deltoid, shoulder joint and the muscles related in the quadrangular space area. I know it's a little bit difficult, just you need to study about this. It's a 10 marks question. How do you answer this question? First define this artery, then mention its course, then its divisions and the branches, and then immediately go for the relations and describe each branch. Thank you. The part 2 continues with the brachial artery.